So now let me come to a question to Will first. UNFPA, you see the people in the rooms here. Can you tell us a little bit about your approach to women's health? It is the UN's agency on women's health. And how do you anticipate bringing all these key stakeholders to the next step, right? How do we get things done on the ground?
Yes, thank you very much. From UNFPA perspective, we take a sexual reproductive health and rights approach. So the rights is, I think, what we have to look at, and it's women's empowerment. That's so important. And there's so many social factors. For those of us who are clinically in low-income settings, you will know that women with cancers come very late. They come so late that sometimes just palliative care is the only solution. And so, it's part of the bigger picture. It's of, being disadvantaged. Probably cancers are one of the indicators for the biggest indicator for inequities, but it's a silent problem that's not getting so much attention because many low-income countries are still struggling with infectious diseases. But I think that double burden of disease thinking is coming forward more and more, and that's why it's so important we have that meeting. What we see also from UNFPA side is that the private sector becomes more and more important. Philips is one of the examples. But another example is the pap smear versus the HPV test for cervical cancer, which really eases. If you do an HPV test nowadays from the cervix, it's so much easier than doing pap smears every few months, because pap smears sometimes never reach the patient. See the patient one in low-income setting, and when she comes back, the pap smear has never arrived. So that's one. We need those innovations, and that's why the public partnership is so important. I believe that for every case we prevent, there's an economic benefit for patients we don't have to treat. So prevention is key. And the question is, who can help us with prevention? And as UNFPA, you might guess it's midwives, it's nurses that we work with, the community. And we can use nurses and midwives really to help with prevention, because the midwife sometimes is the only person who sees a woman in a lifetime during births. And at the same time, she could do a breast checkup, to look at the cervix. There's so many things we can help with midwives. So from that perspective, again, it's this sexual reproductive health and rights approach, where we want to look at other cadres than doctors, which are sometimes very rare in low-income settings, and come back to midwives and nurses. Thanks.